Johns Hopkins University, a major health research institution, says it's eliminating more than 2,000 jobs. This comes after the Trump administration eliminated $800 million in funding from the United States Agency for International Development, also known as USAID. The university says these cuts will force the institution to wind down its work in the U.S. and across the globe. And these funding cuts are just the latest made by the administration. Some public health experts worry they may limit our capability to conduct further health initiatives. Dr. Céline Gounder is with me now in Studio 57. She's a CBS News medical contributor and editor-at-large for public health at KFF. She also did part of her medical training at Johns Hopkins. So how substantial are these cuts and what impact could it have on research?
This is just the beginning. So this $800 million of USAID funding being cut. We are also anticipating more cuts in terms of NIH funding. So this is just the tip of the iceberg. But to give you an example of the kinds of things that are being cut, research on tuberculosis and how better to diagnose and treat it among kids. It is the biggest infectious disease killer in the world. A lot of people may not know that. And we do a very poor job diagnosing and treating among children, among pregnant women as well. That was actually part of the work I used to do when I was at Hopkins. And so that's one of the major cuts. We're also seeing cuts to things like contraception, support for breastfeeding, HIV diagnosis and treatment, and the list goes on.
You mentioned the NIH funding. That could impact funding for mRNA vaccine research. People might think back to COVID times when I say those letters of vaccines. What should we know about that?
So this is separate from what we've been talking about in terms of the Hopkins funding cuts. We are also hearing, first of all, that a number of researchers across the country have been asked to scrub the words mRNA vaccine from any applications they are making to the NIH for grant funding. And we are hearing from sources inside the NIH that there may well be coming down termination of NIH grants for mRNA vaccine research. And the thing is, this is technology that is not just for COVID vaccines. It's for cancer. It's for autoimmune disease. It's for a whole range of conditions. And this has been one of the most promising technologies in our arsenal to address some of these things. It's also, by the way, in a pandemic, the fastest vaccine to manufacture. And we're also seeing the Trump administration talking about pulling back on its contract with Moderna to make bird flu mRNA vaccines, to have us be prepared for that.
What's the problem with mRNA?
People think it has the words or the letters RNA, DNA. Oh, that must mean the RNA is going to change your DNA. That is simply a myth. Our bodies are very beautifully designed to avoid this kind of problem. You have, if you remember your junior high biology,
I don't.
You have a cell, you have cytoplasm, you have a nucleus inside the cytoplasm. Your DNA is inside the nucleus. The mRNA stays outside the nucleus in the cytoplasm, which means it can't go and change your DNA. So this is really a falsehood that needs to be debunked because this is a really crucial technology.
Could cutting grants for vaccine research like this actually increase a situation we're finding ourselves in, which includes vaccine hesitancy?
Well, one concern is that people will hear this and say, oh, well, why is the government stopping research on mRNA vaccines? There must be a reason. The reason is flat earther thinking, unfortunately. It's not a scientific reason, but it may reinforce some of the concerns people have. And by the way, the NIH has also been instructed to stop funding any research on vaccine hesitancy. So we can't even fund or do the kind of research necessary to understand people's attitudes and how they feel about these things.
Real quick, before we let you go, a prominent diabetes study saw its funding slash. What should we know there?
So this was a big diabetes study started in the 90s, currently run, or up until now, run by Columbia, looking at how better to control diabetes, not using medications, but through lifestyle, which we've heard the HHS Secretary Kennedy talk a lot about, wanting to see more done on chronic diseases with lifestyle modifications. That's exactly what this study was about. And in its current iteration was focused on how do you prevent dementia among people with diabetes, yet another chronic disease.
Dr. Céline Gounder, thank you.